One of the biggest challenges in presenting patients is to know what information to include and what information is irrelevant. As a medical student, we often get feedback like, you didn't really need to give me that information, or you didn't have to tell me about their alcohol history, or oh, that was unnecessary. As a medical student or a resident, if you've ever seen your attending's eyes glaze over during a presentation, this is often the culprit. And the problem is that med students just don't know how to balance the details. Sometimes they're going to present too much and they're going to lose everyone's attention. Other times they're going to present too little and then they're going to be asked for more details. And so without having done like a million presentations and knowing every single condition like the back of your hand, what is it that we can do to actually understand what information to include or exclude from our presentations? The solution is to begin with the end in mind. And so this is a quick tip that can instantly improve your ability to determine what's relevant. In this case, the end is your assessment and plan. That's your end goal. So the reason for this is clear. If you know your assessment and plan, it's going to become a lot more obvious what it is that you need to include before you even get there. So let's say, for example, in my assessment, I'm going to say that the patient has a myocardial infarction, and that's the reason why he has chest pain. If I know this, it's a lot more obvious what I need to include in my presentation. So thinking about an MI, I would be thinking, well, I need to talk about relevant cardiac enzyme elevations. I need to talk about the EKG findings and show how it shows signs of ischemia. I need to also talk about the characteristics of the pain. Is it not improving with rest? Did we try nitroglycerin? And things like that, because I'm going to have to argue that this is an MI. On the flip side, I also need to demonstrate that I've considered other possibilities in my differential. So for example, for a PE, if I'm trying to prove that the chest pain is not due to a pulmonary embolism, I probably should talk about the fact that they don't have any DVT risk factors. For example, if I really wanted to impress my attendings, then I might include that in the vitals that I checked the blood pressure in multiple extremities and shown that it was the same blood pressure in all extremities and that they didn't have any tearing chest pain that was radiating to their back, showing that I was thinking about an aortic dissection. Like I might not say aortic dissection in the vital section, but if I talk about that, the attending will know that I was already thinking about it and that I'd ruled it out. Similarly, if I'm trying to show that it's not pneumonia with pleuritis, I would want to say that there was no fever, no cough, or no dyspnea, or something like that. The benefits of this is that this approach makes it much more obvious what to include and what to leave out, which addresses one of the biggest problems that med students have in their presentations. It also will help you to structure your presentation logically and help you build towards your conclusion, since you're going to understand what the purpose is for everything that you're going to include in your HPI, in your past medical history, in your meds, in your allergies, and everything beyond. You'll also be able to demonstrate your clinical reasoning and not just be reciting random fact. This is something that takes 1 minute to check with your resident or your intern before you present. And so the reason for this is that maybe there's some new data or there's some new changes in the plan that have come up. Maybe the nurse just noticed something and told the resident, but they didn't tell you. It pays to basically just check in with them on the assessment and plan. Like, you're not gonna be able to go through your entire presentation, before rounds necessarily, but you will be able to check with your assessment and plan. And that's something that can make a really huge difference. And it'll help prevent you from saying things like, I didn't know that, and have to change basically be corrected by the resident during rounds. If you're a medical student or a doctor preparing for either the USMLEs or COMLEX or one of your medical board exams, then be sure to sign up for our free 14-step program where we'll walk you through the most efficient ways for you to improve your score in a short period of time. And if you're interested in getting there faster, be sure to book a free call with our team where we'll break down what it is that's holding you back and, if it makes sense, explain how it is that we can help you to get there more efficiently.